Hi friends, welcome back to my channel sharing simple knowledge. Today I'm going to solve OET reading part B because I've been receiving many calls from many OET aspirants. They are struggling to crack OET part B and C. So today I'm going to show how we can solve the OET part B, reading part B. Okay. So the technique which I follow is QAT, that is first read the question, then the answer options, and then the text. So in that way, even while reading these questions, we can even predict the answers before reading the text itself. So let's move on to the first question. The first question is asking the clinical trial is. So something is asking about, they're talking about the clinical trial. The option A is open to people with severe respiratory symptoms, exploring new ways to confirm a person has a respiratory disorder. Then the C option is aimed at checking that expert clinical assessments are accurate. So we have to confirm which is what is meant by a clinical trial and which this one is using for what. So the clinical, is it open to people with the severe respiratory symptoms, and is it exploring new ways to confirm a person has a respiratory disorder, then aimed at checking that expert clinical assessments are accurate. That means the other clinical assessments are accurate just to confirm. So let's read the text. First, developing diagnostic tests for respiratory disease using sound measurement and machine learning techniques. Clinical trial. So we got an idea from the first paragraph itself. It is exploring or developing diagnostic, so new tests for respiratory disease using sound measurement and machine learning techniques. That is the definition of the clinical trial. Then they provide additional information about this clinical trial. This study is designed to develop accurate digital diagnostic tests used on a smart device for common respiratory illness in children and adults, including asthma, croup, bronchiolitis, COPD, and pneumonia. These tests can then be used in resource poor communities, emergency departments, and via telehealth applications. So, where we can apply this trial, they are explaining. Then, what is the aim? The aim is to develop tests that are as accurate and expert clinical assessment but do not need a clinical examination or other investigation such as x-rays to be performed. When patients with a history of a chronic respiratory condition or who have symptoms of an acute respiratory disease are included. Patients will be excluded if they have an inability to provide a cough, either spontaneously or voluntarily, are unable to provide informed consent or assent, have severe respiratory disease including the use of CPAP or BiPAP, or have had abdominal or eye surgery within 3 months. These are the exclusion criteria. Then this is the inclusion criteria. So the aim and why the study is designed. So everything is explained here. So let's move on to the option again. The clinical trial is open to people with the severe respiratory symptoms. What is mentioned here? The history or who have symptoms acute. The severe only acute respiratory distress. or chronic, but who has agonic. Actually, if provide correspondingly unable to inform, they have severe respiratory disease. Just means they are excluded. So that is wrong in this option is wrong. Then exploring new ways to confirm a person has a respiratory disorder. So let's see. Developing diagnostic tests for respiratory disease using sound measurement and machine learning techniques, that is the clinical trial. So developing new tests, that is the thing they are telling here. Exploring new ways to confirm a person. So this is the answer. But in order to confirm, we have to check the other option also, aimed at checking that expert clinical assessments are accurate. The aim is to develop tests that are accurate as an expert clinician. But this is not to confirm the clinical assessment is accurate, because they are telling no, do not need a clinical exam, other investigations such as to be performed. So the option B is the right answer. I think it's clear for you. I can do another example for you. So text 2, the guideline highlights. So what the guideline highlights here? The need for accredited interpreters at all appointments if there is a language barrier. That an accredited interpreter is recommended for all antenatal visits. That health professionals are responsible for translating discussions. So let's read. So what do you think? What will be the option for the need for accredited interpreter at all appointments if there is a language barrier? That an accredited interpreter is recommended for all antenatal visits. Do you think for all antenatal visits any interpreter is needed? That health professionals are responsible for translating discussions. Which will be the option? For me, I feel it's A. So let's move on to the text and see. The heading, Pregnancy Care Guideline 2018 involving an interpreter. It is the responsibility of the health professional to make sure that communication is clear. Accredited healthcare interpreters assist by translating the discussion between the health professional and the woman, communicating with the woman in her preferred language either in person or through a telephone service. Involving an accredited interpreter, preferably with training in medical terminology, is recommended for all antenatal appointments if the health professional and the woman have difficulty communicating. So that is the occasion we need an interpreter if there is any difficulty for the communication. That doesn't mean it needs always. Interpreter is accredited by NATI, have been assessed as having a high level of technical competence in both English and one or more other languages, and are bound by a code of ethics including strict confidentiality. However, there is a shortage of accredited interpreters, particularly for languages of new and emerging communities. While involvement of female interpreters is preferable in antenatal care, their availability may also be limited. So when we read here, it doesn't mean we have to understand the whole summary of this paragraph, and it doesn't mean it doesn't tell about that health professionals are responsible for translating discussion. There is the responsibility is mentioned here. It is the responsibility of the health professional to make sure that communication is clear. That is only their responsibility. It doesn't mean they have to responsible for the translating discussion. Then what about the B option? That an accredited interpreter is recommended for all antenatal visits. Is it mentioned here? Accredited interpreter, preferably with the training in medical terminology, is recommended for all antenatal appointments if the health professional and the woman have difficulty communicating, there also option is there. If any difficulty for the communication, that's the occasion we use interpreter. Then what is the option A? The need for accredited interpreters at all appointments if there is a language barrier. That is mentioned clearly here. Just by translating the discussion between health professional and the woman, communicating with the woman when preferred either in person through telephone. So assist there if there is any language barrier we have. So option A is the correct answer for these two. So let's do another. Question 3. The patient safety leaflet encourages patients to. The option A is check the nurse understand the medicine guidelines. B. Ask staff to clarify the directions to follow about taking their medications. Be sure the doctors ask questions about your medicines. From these options itself, before we read, we can predict what will be the answer. The first, check the nurse understand the medicine guidelines. Do you think it will be the answer? Because there itself, that we have to make sure the nurse understand the medicine guidelines. They are already professional and they educated. They know the medicine, how to take it. The patient is the one who doesn't know. So from the itself, it's the wrong answer. We can understand. Then ask staff to clarify the directions to follow about taking their medication. It seems like that correct answer because we have to ask the staff if we have any doubt how to take the medications. Then the third option is, so we can just put it, be sure the doctors ask questions about your medicines. That is not the occasion. The doctors will not ask any question about your medicines. They will just explain and advise how to take it. They will not ask any questions about your medicine. Usually the patients are asking them. So from here itself false is wrong and it will be the answer. But we can confirm with by reading the paragraph. Patient safety advice, medication. It's important to you keep track of your medicines. Taking the right medicine at the right time will help you get well. Using medicines in the wrong way may cause unwanted side effects. To be medicine wise in hospital, you need to tell staff if you had an allergy or bad reaction to any medicines or if you have trouble swallowing medicines. You should tell staff straight away if you feel unwell after taking any medicine. Let staff know if you think you should have received some medicines or the medicines appear different. It is important. We have to look like this. Suppose where it is important that all medicines are explained to you before you leave hospital to go home or another care provider. Always ask your doctor. See, it's mentioned here. Nurse or pharmacist if you don't understand your medicines instructions. So this is the answer. Question you should ask, not the doctor ask. About your medicine in hospital or what is this medicine for? Are there any possible side effects and can they be taken safely with other medicines? So the option is B. Do you want to check one more? So let's solve the fourth one. Question is, if the inpatient team cannot agree on accepting a patient who has to attend a case conference. If they cannot agree on accepting a patient who has to attend a case conference, what they have to do? Option A, the senior medical officer from the alternative specialty, the emergency department consultant and the original inpatient team representative. They have to make a conference, or the patient, the senior patient medical officer and the executive director of medical services. Then the third option is the patient's first consultant, a consultant from the emergency department, and a consultant from the alternative specialty that the inpatient team suggests. So you can just predict and read the text. I know there are disturbance. Sorry for the inconvenience because I have some limitations and my laptop is not working. That's why I'm doing in my mobile. At least because I know many are struggling how to solve this part. That's why I thought I will help from this. Anyhow, I know it's difficult for you to follow. So let's see. Memo to staff regarding escalation process for dispute resolution. If on review, the inpatient team disagrees that a patient requires admission to the respective specialty, the inpatient team shall make the onward referral to the alternate specialty. The senior inpatient medical officer shall provide the alternate specialty with a clinical handover and advice of the time frame in which the patient must be reviewed. In the event of a dispute regarding the inpatient team acceptance of the patient, a consultant level case conference shall be convened. The case conference shall, so this is the question they are asking. If they disagree, who are to make a conference? So, including the emergency department, original inpatient, and alternative inpatient consultant. The three consultants shall make a timely clinical decision regarding the patient's admission. If the matter remains unresolved, then the case shall be escalated to the Executive Director of Medical Services and for a clinical and time urgent decision. So, if the inpatient team cannot agree on accepting a patient who has to attend a case conference, the senior medical officer alternative specialty, that is not the answer because it's mentioned here. The emergency department doctor, original inpatient, that is the first consultant, and consultant from the alternative inpatient consult. So the answer is option C. The patient's first consultant, the consultant from the emergency department, that is mentioned here, original inpatient. So original means the first one, and a consultant from the alternative the patient team suggests. So this is the option. So I think it's clear for you. And if you have more doubts, you can just comment below the comment box. I will try to explain in detail. Okay. Thank you for watching my channel, and if you are watching for the first time, please try to subscribe, like and share it with your friends who are struggling to solve the reading part B. Thank you very much and see you on the next video. Okay, bye.